Welcome to Conversations on Showing Up for Kids. My name's Tim Markle. I'm director of the Southern Regional Center for Children and Youth with Special Healthcare Needs. We cover 14 counties in southern and southwest Wisconsin. We're here to support those families who have children with special healthcare needs and also the professionals who support those families. I am very excited today to welcome Kim, Paul, and Jackie. We are going to be talking about fetal alcohol spectrum disorder. This is one of those disorders that I personally do not know an awful lot about. And so I'm really interested in today's conversation. But I do know that I think I recently read something about the prevalence rate of fetal alcohol spectrum disorder being as high or higher than autism spectrum disorder. And I'm wondering, we hear a lot about autism spectrum disorder. We have national organizations, it's in the news. Why is fetal alcohol spectrum disorder not as well known if the prevalence is that high?
I think a lot of it has to do with stigma associated with it, as far as, alcohol is one of those things that's legal, obviously. And so people don't think of this as an issue. And, it's one of those disorders that either you can have people who are severely affected by it or people who are minimally affected by it. And I just don't think the education is out there. I mean, we still have OBGYNs who say it's okay to have a glass of wine when you're pregnant. And in today's society, with the prevalence of this, that's kind of unreal to hear that information, especially from the perspective of those of us who live with it every day. That's my feeling anyway.
And don't forget the centrality of alcohol consumption in the state of Wisconsin. Have we just been named one of the biggest states to be at the top of the binging list? So nothing like throwing that behavior right in your face as potentially causing harm to your unborn child.
So it's hard to talk about because of the fact that, number one, people don't want to change behavior. In Wisconsin, we don't want to hear that there's anything wrong at all with drinking. You're right. We have a history of Wisconsin with our kiddos going to the bars with us, and it starts to just be normalized. And then you come along and say, but wait, not just if you're pregnant, but if you're thinking about being pregnant, just stop drinking. And that's a tough message to get across.
Especially for the age where drinking generally kind of starts. That's probably some of your most fertile times. If you're in the childbearing years, it's like, wait a minute, I'm at that age where I can have kids, but you don't want me to drink. Wait, hang on.
Yeah, that's a tough message.
What a buzzkill you are.
Right, exactly. How dare you?
And right. I think another aspect of this is that it's interesting how this bleeds over into the doctors and the professionals that should know better, but don't want to alienate their patients or their families by asking the question. So FASD often gets diagnosed as ADHD or autism. And some of the services and treatments that are necessary, that are helpful, are overlap. And so it's not totally unhelpful to have that, but there are certain specific things related to FASD that you really want to make sure you include that's different, that's distinct or additional. The maturity, there's a lot of things that happen that I've heard a lot of families tell me, my kid got all these different diagnoses and it didn't make sense. It was part of it and part of that, but it didn't totally make sense until we got the FASD diagnosis. Then click, everything made sense. And so you're not doing the best you can for the kid or the family if you don't have the accurate diagnosis.
So let's talk. I don't think any of you are diagnosticians. Not that I can even say the word, so therefore I'm definitely not a diagnostician, or else they'd make me pronounce it correctly. But what are some of the features that we're looking for in fetal alcohol spectrum disorder? What's different about it? How is it diagnosed? What are we looking at?
I think the hardest part, I mean, I work in adoptions, and so the hardest part is, I think, having the actual proof for those of us who have adopted, is having the proof that birth mom drank during pregnancy. If we don't have that proof, it's hard for doctors to say for sure that it is an FASD. Um, they can say, well, it could be. It might, even though if we have some of the facial features, they still are reluctant to say that that's what it is. So I think that's the biggest piece that I see in my world of work anyway, is just having that actual proof, which again, then makes it difficult to diagnose anything.
And it's also the kind of the spectrum of conditions that you can have. It's, you know, it's one of the reasons it's called fetal alcohol spectrum disorders. Is it's not a you have X, Y, and Z, so therefore you must have this. You can have any one or all of them and still have it be attributable to FASD. And so it's getting someone to say definitively this is what it is and this is the cause of it. It's tough to nail down. And there's a lot of parallels between this and autism. So sometimes they'll say it's autism, sometimes they'll say it's FASD. We tried to get that same designation made for one of our kids, and the neuropsych that was doing the evaluation, I forget what the exact condition was that she was looking for, but said our son doesn't have that, so we can't give him the autism diagnosis. And we were looking for that specifically so that better services could be put in place than what we were able to get.
So what are some of the similarities between autism and fetal alcohol spectrum disorder? And then are there some major differences?
I think a lot of the similarities have to do with a lot of the social aspect, the social awkwardness, the not able to understand social cues. Like with FASD, we say, even though a child chronologically is 18, socially, emotionally, they're about 9. So they're about half their chronological age when you're talking social, emotional issues. So, you know, when you get to be a teenager and kids start maturing a little bit quicker, our kids with FASD don't mature that quickly. They're still half their chronological age. And so it's a big difference. You really start to see the differences with them and their peers, you know, in school age. You'll start seeing it a lot. I mean, there's other similarities with autism, but I think the social aspect is the biggest one, is what I see.
I think the sensory issues and regulation issues also. That neurological overwhelm that happens with autism, but it looks slightly different with FASD. There may not be the stimming or other types of behaviors. It may look like refusal. It may look like just tune out, I don't care. Because then there's the secondary disabilities, that if this is actually a neurological thing happening, an organic neurological thing happening, the child doesn't know why they can't do something, why they can't remember something. Memory's a difficult thing, why they're overwhelmed and have tuned out what you were talking about because there's too many verbal. The verbal processing is very difficult for people with FASD often. So they can speak very well oftentimes. That's different than autism. They can speak very well, but they really don't know what you just said to them. They're sort of parroting it back, or they're saying what they think you want to hear, want them to say, which, you know, can lead to all kinds of problems when somebody agrees, but they don't really know what they just agreed to.
So it strikes me as we're looking at a lot of, you know, so you said the neurological differences. So we have a brain that is wired what we would consider, you know, not normal. So neurodiverse is the big term right now, neurodiversity. And so we look at what we're stuck with is looking at behaviors, is trying to look at someone's behaviors and trying to figure out what are they getting, what are they not getting, why are they resisting, or why are they not getting it? and not blaming it on they don't want to, but taking that step back and saying, okay, maybe they didn't understand.
But you know, Tim, if we don't have a diagnosis, most of the kids with FASD, I think, since they're not diagnosed, come through that period of not being believed. They come through a period, even when they are diagnosed, it's hard to understand because they look fine. Less than 10% of people with FASD have the facial features that sometimes people associate with FASD. So the chances are there won't be anything that you will notice, even when they do have facial features, those sometimes aren't that noticeable, and then they go away when they get older. And so that leads people to make assumptions about about the behavior. You know, like you weren't paying attention, you didn't care. You know, if you cared, you would have done it. You know, didn't you hear me? You know, and so there's a lot of secondary effects that people with FASD have had to live through because they don't know what's wrong either. It's not like they got born with a rule book that says you have FASD. When people ask you to do this, you will do it differently. You know, they don't know. They don't know why they don't do it. They don't know why they didn't remember. They don't know why. So,
and we as a society seem to want people to be able to answer that question. Well, why did you do that? Well, why didn't you do that? Why didn't you listen to me? It makes sense to me why you would do this. Why didn't you do that? And the question doesn't make sense because, yeah, we don't understand why we do the things we do or why we don't do the things we do. And especially if the brain isn't wired to get to that conclusion. And so helping them figure themselves out seems to be one of the things that you have to do with kiddos with fetal alcohol spectrum disorder is teaching them about themselves. Does that make sense, or am I off target on that?
Right. And that's a big thing, especially when you're talking teenagers who a typical developing teenager, you know, they don't want to be different from their peers. They want to do everything their peers are able to do. But in reality, they can't. They don't like the social media stuff. I mean, if I had the choice, that my kids wouldn't be on social media just because they don't understand the boundaries, and you know, they're going to overstep those boundaries and then find themselves in trouble. And because of the FASD, we don't learn from our mistakes. And so we're going to keep doing it over and over again, even if we have severe consequences in court or wherever in jail, we're still going to keep doing the same things because we don't understand that concept. So teenager years are the most difficult that I think, just with all the hormones too that are going in a typical teenager as well.
And then there's the impulse. Normal teenagers have difficulty with impulses and understanding cause and effect. But with people with FASD, it's like on steroids. It's like
more
exaggerated.
Tim, I got a poem that might set some background as far as, I believe it's written from the perspective of somebody that has FASD. The author is unknown as far as documenting goes, but hopefully I can make it through without breaking down the last time I read it, but here we go. Take my hand and come with me. I want to teach you about FASD. I need you to know. I want to explain. I have a very different brain. Sights, sounds, and thoughts collide. What to do first, I can't decide. Please understand I'm not to blame. I just can't process things the same. Take my hand and walk with me. Let me show you about FASD. I try to behave. I want to be good, but I sometimes forget to do as I should. Walk with me and wear my shoes. You'll see it's not the way I'd choose. I do know what I'm supposed to do, but my brain is slow in getting the message through. Take my hand and talk with me. I want to tell you about FASD. I rarely think before I talk. I often run when I should walk. It's hard to get my schoolwork done. My thoughts are outside having fun. I never know just where to start. I think with my feelings and see with my heart. Take my hand and stand by me. I need you to know about FASD. It's hard to explain, but I want you to know I can't help letting my feelings show. Sometimes I'm angry, jealous, or sad. I feel overwhelmed, frustrated, and mad. I can't concentrate and I lose all my stuff. I try really hard, but it's never enough. Take my hand and learn with me. We need to know more about FASD. I worry a lot about getting things wrong. Everything I do takes twice as long. Every day is exhausting for me, looking through the fog of FASD. I'm often so misunderstood. I would change in a heartbeat if I could. Take my hand and listen to me. I want to share a secret about FASD. I want you to know there's more to me. I'm not defined by it, you see. I'm sensitive, kind, and lots of fun. I'm blamed for things I haven't done. I'm the loyalest friend you'll ever know. I just need a chance to let it show. Take my hand and look at me. Just forget about the FASD. I have real feelings just like you. The love in my heart is just as true. I may have a brain that never can rest, but please understand I'm trying my best. I want you to know, I need you to see, I'm more than the label. I am still me.
Thanks,
That-
Paul.
Thank you, Paul. There is a lot in there. So you all have a personal connection to the challenges of FASD. So I guess I want to ask you, how can kiddos with FASD, how can they be supported? What are some things that works to help them? But then also, what do we need to know about the challenges that the families face who have children with FASD or adults with FASD, because it doesn't go away.
No, it does not go away. It's nothing that you can outgrow. Unfortunately, there's not a pill you can take to make it better. I think for children, it might be a little bit easier to get services involved because of those secondary diagnoses that we're also looking at, either the ADHD or the reactive attachment disorder. Those things are very well known in the DSM-5 because they've been around for a long time as far as the diagnosis goes. So there are services available for children who have those disabilities. But in the adult world, as Paul and I are just now venturing into, because our kids are 18 and 19, it's very difficult navigating what's out there. What can help? What are we going to need? How independently can they live? Can they live independently? Can they live independently with support? What kind of support is available? I mean, there's a lot of things coming at us right now that our minds are just overwhelmed with all of this information, and this agency is doing this, and this agency is doing this, and it can be very overwhelming. And so for me personally, I think the adult world is a little harder to navigate than the children's, because typically, again, our kids look like they're typically developing kids. And so they're going to look like they're typically developing adults. And usually when people encounter adults that don't look like they have a disability, they're going to assume that they are typically developing and they are going to be able to understand everything that's going on. And that's just not the case. And I mean, I have a saying in our house, assuming gets you nothing but in trouble. So if people assume those things, it's going to find a lot of people in trouble. So for me personally, I think the adult world is a lot harder to navigate right now.
And you compound all of that with the fact that you've got the legality of it all, where they're considered by society legal adults. And unless you've got powers of attorney, full guardianship, authorized representatives, whatever level that's appropriate for your situation in place, a lot of people won't even talk to you about it. You know, I just was talking with someone yesterday, and they're like, I'm not even sure I can talk with you about this because that person isn't on the line. And I'm like, well, they're not going to be able to have the kind of conversation that we're having right now. So she's like, well, you're going to have to get one of these things in place. Okay. You know, that's the thing. You never know exactly what level of authorization you need, so that you can go down these roads to get the services and things that your kid is going to need, until you run into the wall and you got to figure out how to get through it.
Right, because you're going into these situations wanting to help.
Exactly.
You want to get the best help for your kid and the most
Right.
supports. And then you get there and it's just like, I didn't even know there was a hoop I had to jump through. I didn't know there was a wall I had to get over. I didn't know that I had to bring my son along with me. It could get really hard really quick.
Right. Yeah, it's a whole lot easier in school age years, because what we found was really going into school as a partnership with all of the teachers, specifically the case managers that'll be assigned to the kids throughout their academic time. And just saying, hey, we know our kids are going to be challenging. We're not going to be the kind of parents that are like, my little Johnny can't possibly have been the one that did this, because it's quite possible that they might have been. So we're not going to come off from a defensive stance. You know, our goal is to align with you in your goal of educating our child. Let us share with you the information we have. We'll try not to give you a blast of water from a fire hose as we're doing it. And you know, let's work this together. And largely we've had good experiences, and I can't speak for that across the board. Even in our situation, we've had a few that were okay, but largely it's been good. And I think if you approach it from that perspective of, you know, let's partner with this, schools have been good in helping, at least in our situation.
Paul, did you feel that you find that you had to educate them? However, you had to be the ones to tell them?
Oh yeah. And like I said, that's the sip of water from my fire hose thing. You've got to really marshal, because you know the teachers are busy. They've got a bunch of other stuff to do besides just take care of the affairs of your kid.
Mm-hmm.
You know, you don't want to give them 500 sheets of paper to read. Give them a 20-page sheet or a single sheet handout kind of a thing, and say, hey, here's some information if you'd like to talk about it, or I'll give you some in another couple weeks, or you know, you got to marshal how much you give them.
So, but as a parent, you get used to whoever provider you are working with, educating them about FASD as first step number one.
Mm-hmm.
And at the same time, you don't want to offend them, right? Because they're the professional, and yet they don't know the basics, let alone what's unique about your kid. So that's one of the frustrations from younger on up. You just get used to that, right?
Yeah, we had it
and you do have to go in and you know, rattle some cages every once in a while and say, hey, now wait a minute here. You know, and you don't come off from a standoffish kind of a stance. You just like, we need to look at this again. You know, I know you're the one who's educated on how to teach. This is my kid, and this is maybe what needs to get tweaked a little bit so that they can get what it is you're trying to get across to them.
But it makes it so much more difficult.
Oh, without a doubt.
You know, not only are wanting what the best for your kid, but then, you know, and dealing with the behaviors of your kid, you have to deal with the behaviors of with the expectations of the professionals. No doubt. An advocate for someone with FASD has it twice as hard, I think.
Oh yeah.
Yeah, now, we had to have it in the kids' IEPs. We had to have it that anybody new working with our boys had to have a small, short in-service with me on FASD first, and how that FASD affects our boys, because FASD, again, affects everybody differently. It's not just a cookie cutter, oh, you have FASD, so you're going to have these issues. It's not that. And so it affects, even between our boys who are biological brothers, it affects them very differently. And so that actually helped, I think, the teachers and even the special ed teacher having an in-service on what FASD and how it affects our boys helped them understand our kids better and how they learn.
Well, and I love that idea of your kid is your kid and you're an expert in your kid. And so it makes sense to partner with the educators, partner with the physicians, partner with a therapist to figure out what is the best way for this child, this human being to learn, this human being to understand. I have noticed that Mary has joined us in the room. And so Mary, I didn't know if we are all talkers on the call right now. So I didn't know, Mary, if you were sitting there trying to jump into the conversation, or if there's anything that you'd like to add.
I was just going to say that I agree with Kim a lot on when our daughter was in school, it was easier because you knew who you had to partner with, and they were teachers, so they wanted to learn. But when you start getting caregivers, it's hard because a lot of the places who do the kind of care for people with disabilities like our daughter, they generally hire people who are going to college or people who are just doing it for the money, but not for they don't really care about the job. And so you come in and they come in with this attitude that I know everything. And so they look at your child as if they're normal, and they treat them as if they're normal, and they give them their independence as they're normal. And that causes a lot of problems. So we have discovered that you just have to educate and educate. And sometimes that means you fire people because they just don't want to get on board. So I guess for me, that is the hardest part, is finding qualified caregivers who are willing to learn about FASD and to understand that their brain is different and they need to be taught different. And sometimes you feel like a really mean person because you wouldn't treat someone else the way that you treat someone with FASD, but that's how they learn, and that's how you keep them safe. So yeah, sometimes it's hard because people get mad at you because they're like, well, why don't you give your daughter more independence? Well, if I give my daughter more independence, she'll be in jail.
Mm.
Yep.
And that is so, I mean, right there is just this really hard spot for parents to be in that I know my kid, and I know if we go a little bit too far with the independence or over too far this way, then it's not going to be safe for them. But yet I do respect them as their own person and as their adult. And I'm not saying they're less than. I'm just saying that due to their brain, we need to be more careful, and we need to take that into consideration. And
that's really hard to teach caregivers that.
Yes.
They don't want to do that. I mean, it's hard. I don't always like being the mean parent, but I feel like I am a lot of the times because you have to be different because their brain is different.
Well, and I think the caregivers look at it as you wanting to hold them back. Or, I mean, I don't think, somebody may be thinking you're mean because you won't let her do this or let her do that. But I mean, I would reframe that, right? I mean, it's not being mean to provide a support that keeps someone safe. So how does that work, Mary? When, like, does your daughter go, take the side of the caregiver against you? Sometimes, is it like?
Well, it will start out that way, but then in a couple hours, they'll be calling and say, I don't know what happened. She's in her room throwing stuff and she's mad at me and she's going to call the cops. So it starts out that, yeah, the two of them are against me, but when they discover that Kim can't handle that, then it comes back to me. And it's hard. You want to say, I told you so, but at the same time, like Paul said, you got to rein in your mouth and train all over again.
Yeah.
And that's, full disclosure, that's even hard to do as a parent. I mean, it's literally an area I struggle with every day because it's like you want to, and I know my wife's like, yep, I keep telling you this. You want to, push them and have them achieve their potential, but dang, it just doesn't happen. And it is so frustrating.
So then what do you do as parents? How do you help other parents, or how do you help you?
Drink heavily. No, I always say it's a good thing I don't like alcohol much because I'd be a raging alcoholic.
This just sounds so difficult, but I know it's not hopeless because you guys are here and you love your kids. So
Tim, I have to jump in here because
please.
because I passionately believe that I'm totally against people saying, why diagnose this? There's no cure. There's nothing we can do. So let's not add this diagnosis, this stigma on your, and doctors will tell parents that I don't want to diagnose your child with this. It's just a stigma. It's not going to help. There's no services, blah, blah, blah. And it drives me absolutely crazy because there are so many things that can be done. And when we try what doesn't work, and it predictably doesn't work, it only confirms the idea that there's nothing that we can do and they can't learn and they don't have potential. I think it is tricky to do, but it's so important to find what isn't working. If somebody was colorblind, which is a neurological function, they can't see something, and we kept putting them in a situation where they had to distinguish two colors they couldn't see, and we kept putting them back there and back there and back there without accommodating the issue and realizing what the neurological issue is, where we're all going to want to drink. You know, we're all gonna, I mean, as Paul said, we're, you know, figuratively, not literally, but you know, we're all gonna be tearing our hair out because what we're trying, I mean, we want to be good parents, we want to be good teachers, we want to be good psychiatrists or whatever. And sometimes the more professional people, the more we care about our job and are conscientious, the more it drives us crazy and we get angry when it's not working, when we do our best. It's because we care so much that we get angry. And so I'm such an advocate for us all figuring out and getting the help that we need from the experts, and they're out there, the behavioral experts and other people, to know what's not clicking in the brain when we see that behavior. And then what do we need to support? So for you asked that question, Tim, well, what can we do? So let's say somebody gets easily overstimulated by going to Target. And whether they're, and you know, the maturity thing is funny because you would think that, yeah, well, I can see a 3-year-old that happens, you know, I don't go to Target and then the grocery store and then, you know, 3 other places before I take my 3-year-old home. But guess what? The 18-year-old, the 21-year-old, the 25-year-old, it still happens. They don't grow out of it in the same way. But part of it is they can learn to if you repeatedly explain, to tell you, look, this is too long for me, you know, I'm done, I need to go home, so that they don't have a tantrum anymore. But you still need to figure out a lot of it's environmental prevention kind of things. You put things in place, you change things. I mean, if I would ask Paul and Kim or Mary, the things that they change about how their families do things because of the person with FASD, you know, then things turn out better. There's things that you can that you can do. So maybe you guys can talk about some of the things you do that work.
Well, just even in like larger family settings, you have to, and I think to some extent it was, for some people, a little challenging to get on board with what it is that we're dealing with, you know, because there's expectations of, you know, you go to a family meeting, you're supposed to be there for the entirety of however long the meeting is. Let's say it's Christmas or whatever, you know, Thanksgiving, whatever.
Mm-hmm.
You're expected to be at the table, around the tree, whatever you're doing, for the start to the finish, and sometimes it just can't happen. It's like, well, yeah, they need a break. You know, there's too many people going on. There's too much noise. There's too many people opening gifts. There's just too many things. And
so what do they do for a break, Paul? What works?
Well, like my in-laws, you know, they've got multiple bedrooms that like they just take their iPhone or whatever,
Yep.
you know, to one of the bedrooms, shut the lights off, and do whatever it is that they're going to do in there. And you're gone for an hour or two, and they may or may not come back. And you know, as much of a change from what the typical expectations are, it's like you can either have that, or you can have an explosion. Which do you want to have? You know.
Right. And it's easier when they're kids to be able to tell somebody, hey, they need a break. You know, you would tell a 5, 6, 7-year-old, you can tell when they're overwhelmed, even a typically developing 5, 6, 7-year-old, yeah, I need a break, and they understand that. But when you're talking an 18, 25-year-old who still gets overwhelmed, and we still have yet, our kids are 18 and 19, they still have not stayed by themselves overnight in the house. They can stay all day, but they have never stayed overnight. And to try to get somebody who understands those issues and can still stay with them so that we can go away for a weekend by ourselves, they're going to look at you like, well, they're 18 and 19. Why do you need somebody to come stay with them?
You really still need a babysitter?
Right. So again, it's a lot easier. It's a lot easier to explain even to extended family members when they're younger. But now at this age, if I were to ask, a cousin to come and watch the boys or to sit with them over a weekend, they'd think I was crazy, because they're 18 and 19. They should be able to do that on their own. And it's just not the case.
And that's, it's just not the case. It's just for this individual, for this child, that's just not going to work. For this adult, it's just not going to work.
The kids will fight you tooth and nail saying, but I'm 18, I don't need somebody. Yeah. Yeah, but I'm 18. Yeah. They'll be coming anyway.
Well, I do know that we have some people that have joined us, and I want to make sure that we leave a little bit of time for any questions that they may have for you. If they'd like to unmute or put something in the chat, I will watch the little microphone. I'll watch the chat. But as we're waiting for any questions that come in, I also don't want to leave without somebody telling me what the heck Orchids FASD Services is about and why does it exist? And can you give a little bit of hope to other families that are out there?
Go for it, Jackie.
I thought maybe we were looking for someone else to talk first, to ask a question. Well, Orchids was started by like over 10 years ago by families and some professionals who were had people with FASD either in their practice or in their families, and saw the need for supports here in Wisconsin. So it's a local affiliate. It's the only, Orchids FASD Services is the only Wisconsin organization devoted to advocacy and education and support for people with anyone dealing with FASD, a person with FASD. We have adults with FASD that participate in some of our things. We have professionals that are looking for supports or looking for solutions or resources, maybe I should say. Professionals need to educate their colleagues a lot of the time, so we kind of help them out with that. We do some advocacy, but we're the local affiliate of a national organization, which is called NOFAS in Washington, D.C. And many of our states have local affiliates. So if you want to know more about FASD in general, you can go to NOFAS, NOFAS.org. If you want to know more about Orchids, you can go to orchidsfasdservices.org. And that's who we are. We're just a very small group of unpaid grassroots volunteers.
Oftentimes very frayed at the edges.
Well, and we do have a question. What are there any resources that you would recommend when trying to educate teachers or home staff about FASD? I know we can Google, and Dr. Google will tell us everything that we need to know.
Everything.
But what is it? Is there a place? Is there specific resources that have helped you to educate others about FASD? What would you recommend?
Well, Orchids has on our website, we have info packets, which are designed for different professionals, and sort of they're short, like fact pages, 1 to 2 page things, because professionals don't want to read a 15-page paper, research paper, and those are out there as well. But we have info packets for professionals on the Orchids website. And the CDC, whatever that website is, the CDC website, .gov, it would be .gov, has a lot of training resources for FASD for medical professionals, including social workers that would work in conjunction with medical professionals. So yeah, nofastcdc.gov and orchidsfasdservices.org. We have lots of resources depending on what your needs are for educating people.
I also am a certified FASD trainer that I became certified a couple different times through the UW Department of Family Medicine. So I do go to schools and other organizations to do free trainings. I offer them free just because I just want to get the information out there. So right now I'm just doing everything free of charge, especially to school districts and other agencies that might work with people with disabilities, just to be able to make this a little bit more known in the world of disabilities.
And I've added some of the websites that Jackie referenced in the chat, so you can feel free to copy those and check those out. I'm not sure. Well, I guess through FASD, you would be able to get a hold of Kim if that'd be something that you'd be interested
Through
in.
Orchids, yes.
Through Orchids, Orchids FASD
Services.
there. I knew I had something else written on my paper there, Jackie. I was getting there. I was getting there.
Sorry, Tim.
We have a couple minutes left. What closing thoughts would you give to, let's say, family members who have a child or a relative with fetal alcohol spectrum disorder? What's your best words of advice that you can give to them?
You're not alone. Because I think a lot of people feel that they are alone because it is an alienating disability because people don't understand. Even with younger children, people think that, well, you're just letting them get away with something. Well, no, we have to parent them differently. I think there's a book out there that's called Parenting Differently or Trying Differently Rather Than Harder or something like that.
Right.
Which is, that's the key, is that people need to understand that we do have to parent them differently. Just because they're 18, we still have to parent them like they're 10 or 11 years old, because that's where their brain level is at. So I think just letting families know that there are other people out there who have been through it, who are going through it, who can offer some support, even if it's just an ear to vent. Because I know, especially for single parents, you don't have anybody to tag team out. When you have a partner or a spouse or something that you can say, I'm done, it's your turn. I can't deal with anymore. Your tag it out. But with a single parent, they can't. So I think the most important thing for me anyway is just to have other families or other people who understand what it is that you're going through and can offer a listening ear.
And we have support groups at Orchids FASD Services. We're getting that going now. So there's a FASD support series that meets the first Friday of each month. So you can check that out on our website, the support series, and get involved with connecting with other parents.
I guess one other thing I would say is a couple other things is, whatever your stance is on therapy, whether you think it's helpful or not, it's a really good idea to have somebody to talk to, either about your own personal situation, about your marital situation, your overall family situation. Hopefully you're able to find somebody that has some sort of knowledge and appreciation for what it is you're going through. Not always the case, but keep looking until you find somebody like that. And then I think another thing that I still struggle with is coming to terms with, everybody starts out this path with the notion that, you're going to have that hallmark experience that's going to be, I'm going to be throwing the ball around with my kid and we'll be doing all these things that you see on all the postcards and all this kind of stuff. And the reality of that is sometimes it just doesn't happen. For whatever reason, it just doesn't happen. And you need to kind of put those things aside and say, that's just the way it's going to be. And it's been tough for me personally, I'll full disclosure, because of course you want those things and they just, yeah. So adjust your expectations, go through the grieving process, because there's a grieving process that goes along with those adjustments. It's not easy. It's very disheartening sometimes, but yeah.
And Mary, did you have any final words that you would like to give us in parting?
It's really important that people get the FASD diagnosis, because when they become into the adult world, they do look very normal, and people want, and they can do a lot of normal things, but then there's this whole reasoning problem. And then, you know, they have this meltdown and everybody's kind of looking at you like, what's wrong with your child, you know? And it's just so helpful to have that diagnosis, to give to caregivers, to give to teachers, because you cannot lump all disabilities together. And it really angers me when my daughter was in school, they're like, well, we don't really need to know that diagnosis. We just treat them all the same. I'm like, you're not going to treat my daughter the same, otherwise you're going to suspend her. But so I think the most important thing to do to any parents out there is get that diagnosis, and make sure you get guardianship if necessary, because going into the adult world, you need to have a lot of that control over your adult, because like Paul said, a lot of people will say, hey, he's 18, he can make up his own mind. And you just can't let them do that.
As much as you'd like them to be able to.
Yes.
Right.
And just one final word, Tim. I know we're kind of over time, but
I will always let you have one final word, Jackie.
it hasn't been said that individuals with FASD can have average or above average IQ. So that makes it really even more of an invisible disability, because even the professionals will say, you know, the IQ is there, they're not eligible for services.
Right.
What are you talking about? But functionally, in some areas, crucial areas of safety and memory and judgment and learning from mistakes, and the more executive functions and the sensory things, the self-regulation, don't really impact IQ. So they can do really well, and you know, IQ tests and things like that, and they can get into trouble, use their brains to get into trouble really well too, without knowing what's safe and what's not safe. They don't do well with abstractions. They're very concrete, hands-on people. There's a lot of different.
You could have a very typical normal IQ, but if a dollar bill does not equal 4 quarters, you got a problem.
There you go.
That's a very real situation for our kids. We
Yeah.
literally hit that scenario earlier on.
Or I don't know the difference between $2 and $20 or $200. You know,
Exactly.
it's all the same, but it doesn't matter.
Right.
So,
Well, I want to thank you all for being here and helping us learn more about not just about FASD, but supports and how to help each other when we come across challenges. So thank you all very much. I am very glad that we have Orchids FASD Services in Wisconsin that I know that we can refer families to when they call the regional center, and that they're going to find support and understanding so that they don't feel like they're alone. As Kim said, is you don't have to do it alone. So thank you all. If you want to just hang on, I'm going to stop the recording and then we can do our other mushy goodbyes. So just hang on 1 second.
thank you, Tim.